It's having a hard job doing it.
Yeah, I can see that. Yeah.
And within only a few seconds, it should give me a reading.
Yeah.
So, you notice this is not working right now.
No, it won't do. There's no pulse.
Yeah, if I take that off, and I'll put it on my finger, and I don't have a tourniquet on, hopefully within a few seconds.
Oh, yeah. What is it? 98?
98%.
That's
You like that? Feeling faint. So
Have a
proof.
cigarette.
Let's just give it a few seconds. Just give your hand a squeeze, flex your fingers. Let's get the blood going. So let's see if we can make sure that your circulation is
Pulse back.
Or you're a vampire, it'll be one of those.
Yeah.
Vampire! You're one of the undead.
Vampire weekend in Vienna this weekend. Thousands of people are dressing up and wandering the street. Wow.
Have you got it? There you
There
go.
you go.
99%. Woohoo! So for somebody, have you ever put a cap to on a can before? Please say no.
I have.
You have?
The bit where you clicked it under was really difficult. I couldn't picture it at all. It felt like different than it was.
And that's where training and familiarization comes in. Somebody, it proves the point, somebody with very minimal amount of training as far as, again, imagine being quite stressed as well. The minimal amount of training can learn in a very short time how to use this piece of equipment. I've had an argument with a Ukrainian doctor, some kind of surgeon, who said that it was impossible to teach somebody how to use this piece of equipment. Impossible. We just did it with somebody blindfolded.
Yeah.
Of course, they didn't like it when I did that part. But it proved the point. Unfortunately, these people have influence over lots of other people. And sometimes, if they get believed, it's not always the truth, and I guess that's why a lot of us are here too. There's nothing like your own experience, and the experience of others who you trust, and training and practice. It doesn't have to be medical equipment, it can be any piece of equipment, it could be your new poncho or whatever it is you want to use. Take it out of the plastic, take it out of the packet, make sure it works. If it doesn't work, or it doesn't work for you, put it down to experience and move on and find something else that does. So I can't say that all the training I give you will work for every situation that you're in, because it won't. Because the situation will dictate that you can't use these hands properly because your hands are so cold because you lost your gloves. And to compound the situation, now somebody or you have got another injury. It's very difficult to prepare for that, but we can get close to it. So, just a quick one. One of the things I do in my tourniquets is I use these you guys want at the back.
We have false photos where most of the people are blacked out. Special services of French Foreign Legion.
Yeah, I did a seminar in Italy, and the video that I had to do, some people had their face. Before they would give the video back to me, they had their, what's it called, faces out and everything. Yeah.
So there are plenty of kind of resources that you'll find on the internet. You're going to find stuff on YouTube. But again, there's nothing like, again, I'm being a bit biased, but there's nothing like attending a course where you get the opportunity to practice. Even if it's just a month, you don't have to attend a necessarily official course, but as long as it's with a group of like-minded individuals, make sure it's with individuals that have the training and have the experience.
Actually, Tim, just to quickly jump in there. Tim and Shelley have actually offered up one of their courses as basically the top prize of the raffle.
Yep.
And I'm not trying to get you guys to buy raffle tickets, but you can actually go along to the Czech Republic and actually have this hands-on course. So they're very kindly actually done over. It's just informing on it.
What language will it be in?
Ooh.
Any language.
John, do you want to press stop?
We've been English, we do a glad you mentioned it.
It's going to be interesting.
So let's say this chap here has got a catastrophic, a potentially catastrophic injury to his leg. Right? You just mentioned him having things in his pockets. Things in people's pockets can affect how tight you have a tourniquet on, especially things like mobile phones. So if I put pressure over the top of that mobile phone, it's not going to be as effective as it would be if it wasn't in his pocket. Do you mind emptying your pockets for me?
Do you know how to get 3 grown men off the floor with 2 fingers?
It's not the time.
I can do it.
Just reminded me.
When you did your original first aid training, do you remember pressure points? As a means of controlling bleeding? It's still there.
I teach pressure
Pulse
points
is where the postal services can
and in math and pressure. I teach pressure
If we
points.
put on pressing it hard enough, I can actually control bleeding,
Yeah.
blood getting to my hand. So I can actually use it to control injury to the hand, stop bleeding. Yeah? Same as I could if I had a lower limb injury to the arm, I could use the brachial pulse, so where you put it above the humerus, underneath the biceps. I could press on nice and hard, and that in turn would help control bleeding. We've also got the femoral artery. Okay.
He's married, you're fine.
Yeah. I'm married, you're okay. Femoral artery. Now, imagine that there's a lot of blood hosing out of his leg right now. Which side do you dress? That way or that way?
Stephen, can you hold the camera?
I'm actually putting quite a lot of pressure on you right now.
Do a lot of
I can
editing out.
control-
This
with my
part
hands
of the
free,
shoot.
I can control bleeding to the rest of his limb by putting direct pressure on his femoral artery. Whilst I'm doing that, I can be getting my tourniquet prepared, reassuring him and telling him everything is going to be okay, whilst I position the tourniquet so that I'm ready and I'm in a position to apply it. I could even get somebody to help me. Because let's face it, guys, at the end of the day, it's not all about doing it all on your own. If you can get help, you will. That pressure could be applied by somebody who's doing it with their hand too. Of course, that's the other thing you've got to think about. Don't be afraid to touch people. That's kind of something that people have to get over psychologically. As a medic, I have lots of practice, so I'm not really bothered about it. So when I put my tourniquet on, notice I put it nice and high. That way, if there is any penetrating injury, I'm covering. So when I get my tourniquet on, I can adjust it, take it through both sides. Now, some people can have problems because they're trying to do it, and all they're doing is they're actually just doing a seesaw and moving. They're not actually tightening it up. So what I need to do is, of course, I need to get to the windlass. So if I hold on to the buckle and then just pull down, back, pull down, I can get it nice and tight.
So you put it in both first, and then
Put it in
try and
both.
get it first, as opposed to second after you've done it down.
Because if I did it second, it'll just loosen off.
Okay.
And because he's got 2 hands, he's not doing it on himself. He's got 2 hands, he's got time, he's got the dexterity.
So then all I'm going to do is, okay buddy, I'm going to tighten it up nice and tight. That's one revolution. Looking at his face and just one more time. Let's chill. I've only done it twice.
Oh,
That's how I don't want your mum phoning you up. Did you do that with my boy today?
All that bruising.
So I put the little tab over. Don't cover it. These can easily get lost in the clothing and bedding like that. So when he does get to further care, somebody needs to know about it. I need to be looking for this. If you've got a magic marker or a big felt tip pen, stick a T on his forehead.
right.
Not everybody has had the benefit of the training. So not everybody knows to look for one of these. If I was a medic at a receiving station or an aid station, one of the first things I'd be looking for is this. Only because that's the environment I train and I work in. but not everybody has that level. So the best way to show everybody that it has been done, or have a big thing around his neck that says he has a tourniquet. Like I said, you need to be able to do this yourself too. Thank you very much. So, I'll let you have a seat. Make sure you can see. So I've got my tourniquet. I've been in a vehicle accident. I rolled the car. And I'm somewhere in Scotland. Underneath the dashboard or wherever it is. I've got my glove with my phone. I've got a first aid kit. I can get access to the door of the vehicle. Either way, I can reach it. So, because the vehicle rolled over, and I had the window rolled down, this arm has got quite a nasty injury to it. And because part of the side of the car came in, I've got injury in the top part of my legs, and where the steering wheel came down as well, because the vehicle went over a few times. So I'm quite stressed right now. But I know there's something wet and warm going on, and it's not good because I don't feel well. So in my head right now, I'm thinking, what is going to kill me? Bleeding to death. So I need my first aid. And I'm able to identify that I have an injury to my leg. I don't know, it's some piece of metal or something is obviously stuck in my leg. So if I've got anything in my pockets and I'm able to get to it, just take them out. And I'm going to get my shoe in it. Sorry, this was a bad arm. I apologize for that. Sorry. Get my tourniquet. Now I can't use this arm. This is no good, so I'm going to go on my back. Find the business. So which way do I want to go? I want to go that way, or do I want to go that way? That way. So if I take this, I can put it in my mouth again if I want to, just so I know where it is. And underneath my knee is a natural arch, so it means there's a space. Or underneath my buttock, at the back, there's a space too. So I've always got somewhere that I can thread it. If I can move my legs together and pinch it in place, that's a good start, that's possible. Notice it's kind of sticking up too, so that means I can get to it, and then one-handed, take it, thread it through. No, this is an old tourniquet, it's been used several times, so it's not nice and new and shiny and it can slip through. So I need to get this as high as I possibly can. So if needs be, adjust it. And then, take the end. Notice I'm kind of using it as a ratchet, and then the back on itself. Using as much effort as I possibly can. Remember, I can lie on my side if I need to adjust it. And then, take the windlass, one revolution, great. I could probably get it a bit higher. One hand. If you have two hands, fantastic. Two hands is better. If you can train and do it with one hand, do it with two hands. That's not to say don't train with two hands, of course you train. As I say, that wasn't in a wartime environment. I didn't get hit by an IED. I was in a vehicle accident because I was on my own because I wanted to go away and get away from it all, hiking for the weekend. I could take it to the war if I wanted to, but it works in both situations. But it's the worst case scenario. Hopefully, it's never going to be that bad. But we always train as if it was anything else. So pass it back round. Get people to try and get one up on your leg. Sit down on the floor. Do it on the floor. get somebody to do it on you as well.
I'm trying to stick all most of this on YouTube. I'm going to do a video on you as well. We might as well get as much footage out as possible.
How do you go? Have you ever met this person before? Do you know each other? No. Now's the time to get to know each other. Did you follow any of the stuff that I was doing?
I'll do the first half. I'm alright with this.
This chap sat here through all of it.
It's a good way to make friends with
It's
return
an
on
excellent way to make friends. So what you're going to do is start off with...
They hurt. I've bought one. I've bought one. I'm going to practice when I get to the tent. It is painful. It is true. Sometimes you have to pay expenses.
But then again, it's true. It is one of the things that is lifesaver.
So when you're doing it on yourself, you can do it through one side of the buckle.
Might need to go on
When you do
tighter.
it on someone else, do it through both sides of the buckle.
That's Denise. Is that Denise? Ah, okay.
I couldn't
It's a good...
I didn't even
it's a
know.
good, yeah. So, make sure I've got it nice and tight.
Yeah.
Give myself plenty of leverage as I can. So all I'm doing is I just pull up on the buckle.
right. Yeah.
Notice I can get it a lot tighter.
Yeah.
Bloody painful.
And then...
Tighter.
I thought my arm was going to drop off. Here it comes. It's painful, isn't it?
But my arm's gone to sleep in sympathy.
I can get that in another turn if I need it.
I think that's probably fine.
It's fine. But it needs to be, and so if you've got the person going, that's great. Great. It means they've got an airway. But remember, you need to check the lip. It's not just about him going, oh, it's okay, I'll walk away. Look. And if it's still bleeding, maybe you haven't got it done up right. Reassess it. But don't let it bleed. There's no reason again why I can't use a pressure point. Or somebody has got a big bandage and is going, whilst I'm applying the tourniquet. Do you see what I mean? There's nothing that says, oh no, we put the tourniquet on first and then we have to wait and put the bandage on afterwards. Somebody can be applying the tourniquet while somebody's doing direct pressure with a field dressing to try and control the bleeding as much as possible.
Because it's quite a high success rate in saving a life. Because I was on a knife safety course, and the checkers taking said they take 10 minutes to deal with because the actual success, the chances of survival is so slim.
It depends, right? Depending on the environment that you're working in, bearing in mind, if I'm a civilian and I'm in an ambulance, how far realistically am I away from hospital? 20 minutes?